I have a question for you, Andrew. We're through the Chamber of Commerce. We're working with other chambers around the state to take away the law that New Mexico passed back in, I think it was '97, that chambers and other organizations cannot sell group health insurance. And we're one of the few states where that law is in effect, and we want to get rid of it because I think with a 500-member Chamber of Commerce, if we're able to sell a group policy to our members, we can save them a lot of money, and that, after all, is our main objective. Do you see any problems with the new health laws as far as contradicting what we're trying to do?
Not that's right off the tip of my tongue. I mean, I think that in some ways what you're saying makes a lot of sense, though, because that will increase pooling. That can allow you all to have more leveraging power. A lot of that is kind of some of the driving power behind the law. I think it would be, the question would be, what are the state legislators' feelings as to why to keep that provision enacted or to repeal it? And I think that would be a really interesting, part of the discussion that I'd love actually to have. I mean, I think it's probably a longer conversation than we have now, but I think it'd be interesting to hear what are some of the proponents of that provision and what are some of the opponents of that provision saying, and why are they saying that they either want to keep it in effect or take it away? And what have you heard on that? I think that would be a really interesting discussion. I think it'll probably play out in January as well with your legislators. But I think a lot of those same ideas are happening within the small business pool that are happening. There's an opportunity to form a co-op. New Mexico, Health Action New Mexico is actually working to form a co-op here in New Mexico to be provided on the exchange. Also, the Office of Personnel Management will be overseeing 2 nonprofit plans that'll be multi-state, offered in every state, that'll also be offered on the exchange. The Office of Personnel Management is the one who oversees federal health care employees. And that's kind of that whole idea of, well, why doesn't the senator just make sure that he gives me the same kind of insurance he gets? Well, that's exactly what he's trying to do with that, the OPM plan that'll be offered on the exchanges. So I think a lot of the same ideas are in effect. I'm just not sure, what are some of the arguments on both sides of the equation on the state level.
We'll talk more about that.
Great.